This is an excellent question. Obstetrical anesthesia may one of the top question. Which is the one? Minimal motor blockade, good sensory blockade. Do you want that? Definitely. If you are giving epidural analgesia in the labor, why you want motor blockade? You want only sensory blockade. So selective sensory blockade with minimal motor blockade. You are looking for a drug. Which one it is? Yes? Ropivacaine. Anybody thought Levo-bupivacaine? No? Okay. So it is the Ropivacaine. Differential blockade it will provide fundamentally, and compared to Bupivacaine it has a lower systemic toxicity, which is another advantage. Comes the Mapleson system. I lost half an hour because I never understood Mapleson as an undergraduate, entrance preparing guy. MD General Medicine में join होने के बाद it is impossible to understand also. I mean, few things you can't do after joining a specialized course. Okay, what was your answer? Huh? A or B? D, no? D, no? Option D, you mean Mapleson F? F. Okay. But the answer given was B. I thought there was something fishy. It was given as F only? Oh, thank God. I think maybe my type is mistake. Okay. What is the marker of bone formation? Huh? Calcinin or telopeptide? Both, but generally very reliable. You are, for example, why do you need to know the bone formation marker basically? नानी माँ को osteoporosis है. Lot of pain is there. You have done DEXA scan. -20 है. -2 is actually world standard. उतना osteoporosis है. You are worried that नानी माँ का spine can fracture. So what will you treat her with? PTH analog, parathormone analog, teriparatide. Once you give teriparatide, you want to know how teriparatide is working. Is the bone formation once more picked up or not? For that you need to follow some laboratory measure, no? Commonly which laboratory measure is followed? Telopeptide is partially right, but we depend on osteocalcin as a biochemical marker to follow up whether bone formation is going on well or not. MALGAIGNE'S fracture, Monteggia है, Colles है, वो सब छोड़ के MALGAIGNE का जरूरत क्या है एग्जामिनर को? So, how many first time heard it in the today's exam? MALGAIGNE. 1. 3. Honest opinion. That means you all know MALGAIGNE much earlier? Sure? I don't know. First time I came to know. Okay. What was your answer? Okay. D. Very good. Was it a previous question? Hey? Acha, acha. So, both the pubic rami and sacroiliac complex, posteriorly SI, anteriorly both pubic bones. Both the pubic bones and sacroiliac joint fracture together is called MALGAIGNE. So, when will you put the patient to go into aeroplane splint? Whenever there is a brachial plexus injury. Cock-up splint is for radial nerve injury. Very good. Pulled elbow. Very good question. Very practical question. Suddenly your own child, he is saying that no, I will not come to LKG for entrance exam, I nahi likhunga. Then you will be saying, what are you talking? LKG entrance only if you are not ready. First you take a mock test for the LKG entrance, then go to the regular entrance. You pulled his hand. When you pull a hand of a resisting child, it can undergo a transient dislocation. But it is not a permanent event. It can be reduced. So what was your answer? D. So what is the correct way? What is wrong about this? Supine. Supinate and flex. There is also a pronation and flex. I mean, flex and pronate also is there. The problem, the wrong is not with supine and prone. Which will you will apply direct pressure. But what is the order? First direct pressure, then supine and prone, or so let us check. Because this is a very practical thing you come across with the children in the home. It is also called as nursemaid's elbow. Apply pressure on the radial head first. Make the child sit on the lap of the parent. Then fully pronate the forearm. And then you flex the elbow. Then there is one more maneuver called supination flexion. First apply pressure on the radial. And then you supinate the forearm. And then you flex the elbow. So applying pressure is the first thing to prevent it from coming out. That is very important. So what is Charlie Chaplin gait? Another very standard question, previous exam. Tibial torsion. Bilateral external torsion of the tibia is what need to be basically remembered. Now, 65-year-old fell down, external rotation of the leg with the lateral border touching the couch. What is your answer? Huh? Intracapsular or extracapsular? Extracapsular. Extracapsular. Sure? Not sure. No problem. There is a big story behind it. Huh? So, question number 59. Our online students are also agreeing with us. Tomorrow's AP entrance, you will get straight away the same question, doctor. Incidence of extracapsular is more. You need lateral violence in extracapsular, but intracapsular with minimal rotation violence only it can occur. External rotation is fully external rotated in extracapsular. उनको रुकने वाले कोई भी नहीं है. Extra capsule, capsule के बाहर निकल गया. Then local swelling marked in extracapsular. And if you look at treatment, it is more easy. You can bring back a child who ran away from the home more easily than a child who don't leave the home and keep crying inside the home. Then what complications do you see? Non-union is more often a feature of intracapsular due to the avascularity, and malunion because of running away and coming back means joining utna asa nahi hota. Father and son will still be arguing after coming back. Malunion is more with ran away extracapsular fracture. Okay, doctor?